Welcome to the We Level Up Treatment Center video series. In today's video we will discuss barbiturate overdose. Barbiturates induce relaxation and drowsiness, but an overdose can prove fatal. The addictive nature of barbiturates can lead to physical dependency and potentially life-threatening withdrawal symptoms. Tolerance to the drug's mood-altering effects develops quickly with repeated use, increasing the chance of severe poisoning with continued use. Causes of barbiturate overdose. Barbiturate addiction is a serious issue affecting many individuals. While most people use these drugs for legitimate reasons, those who abuse them often begin with prescriptions for themselves or their family members. Overdoses of barbiturates typically involve a mixture of other substances, such as alcohol, opiates, like heroin, oxycodone, and fentanyl, or all three. Typically, people who combine these substances are either inexperienced and unaware of the risks or are intentionally seeking to alter their minds. Regardless of the intentions, the consequences of drug combinations with barbiturates can lead to coma or death. Barbiturate intoxication symptoms and signs. Barbiturate intoxication can cause various symptoms, depending on the drug use and individual factors such as age, weight, and overall health. Some of the signs and symptoms of barbiturate intoxication may include drowsiness or lethargy, confusion or disorientation, slurred speech, impaired coordination or balance, impaired judgment and decision-making, euphoria or mood changes, impaired memory and recall, slow breathing or breathlessness, low blood pressure or heart rate, coma. Small amounts of barbiturates can cause severe symptoms, particularly when combined with other drugs like alcohol, opioids, or benzodiazepines. The risk of overdose is exceptionally high when individuals misuse barbiturates to get high or manage other drug cravings. If you suspect that you or someone else may be experiencing barbiturate intoxication, seek emergency medical attention immediately. Prompt treatment may be the difference between life and death. Barbiturate intoxication overdose dangers. Barbiturate intoxication and overdose can be extremely dangerous and even life-threatening. The risk of overdose is exceptionally high with barbiturates due to their narrow therapeutic window. This means there is a small margin of error between the amount needed to achieve therapeutic effects and the amount that can lead to toxicity or overdose. Even with small doses, barbiturates can cause addiction and dependence, increasing the risk of overdose. Withdrawal from barbiturate abuse can be severe and life-threatening, with symptoms including seizures and delirium. Due to the risks associated with barbiturate abuse, medical supervision and monitoring are essential during withdrawal. Barbiturates drugs are hazardous when not used under the guidance of a medical professional. If you or someone you know is experiencing symptoms of barbiturate intoxication or overdose, it is essential to seek medical help immediately. Barbiturate overdose prevention methods. Preventing barbiturate overdose involves several strategies. Medical guidance. Always follow healthcare professionals' advice regarding the prescribed dosage and frequency of barbiturate use. Avoid self-medication. Never self-adjust medication doses without consulting a healthcare provider. Limit use. Minimize the use of barbiturates to the prescribed amount and duration. Combination risks. Avoid combining barbiturates with other central nervous system depressants, such as alcohol or opioids. Regular checkups. Schedule regular checkups with healthcare professionals to assess the ongoing need for barbiturate medication and make any necessary adjustments. Education. Stay informed about the potential side effects and risks associated with barbiturate use. Substance abuse treatment. Seek treatment for any underlying substance abuse issues, as individuals with a history of substance abuse are at a higher risk of overdose. Secure storage. Keep barbiturate medications safe, away from children or anyone who might misuse them. Emergency response plan. Educate family members or close contacts on the signs of overdose and establish an emergency response plan. Support networks. Engage with support groups, counseling, or therapy to address any mental health concerns or stressors contributing to the risk of overdose. Prevention is a collaborative effort involving the individual and healthcare professionals, and open communication is crucial for effective prevention strategies. Barbiturate overdose symptoms. Barbiturate overdose symptoms and signs include confusion, lethargy, slurred speech, nausea, vomiting, respiratory depression, unconsciousness. Additional barbiturate overdose symptoms. Barbiturate toxicity signs include impaired awareness, difficulty with coordination and muscle control, clouded thinking, being unsteady on one's feet, slower than average heart rate. In severe cases, barbiturate overdose can lead to coma or death. The above signs all indicate decreased consciousness triggered by severe barbiturate overdose symptoms. Furthermore, diminished urine output can also be an indication that there is something adversely affecting consciousness. Barbiturate overdose symptoms of a critical medical emergency. Further symptoms are telltale signs of a critical medical emergency. Barbiturate overdose signs can become painfully clear with shallow breathing, clammy skin, dilated pupils, respiratory failure. A resulting overdose can be fatal. Are barbiturates addictive? It's vital to understand the potential for addiction and abuse associated with barbiturates. We delve into barbiturate addiction and the signs and symptoms associated with it. Barbiturates addiction signs. One of the most common signs of barbiturate addiction is an increased tolerance to the drug. As the individual continues to take barbiturates, their body may build up a tolerance, requiring them to take higher doses to achieve the same effect. Individuals using barbiturates for an extended period may also experience memory impairment, lethargy, and decreased cognitive function. One of the most significant barbiturate overdose risk factors is addiction. If a loved one struggles with barbiturate addiction, seeking professional help is essential. Treatment for barbiturate addiction often involves medical detoxification, followed by counseling and behavioral therapies to help the individual overcome their addiction and develop healthy coping mechanisms to maintain sobriety. Barbiturate addiction is a severe issue that cannot be overlooked. While they may be effective in treating specific conditions, it's crucial to understand the potential for addiction and the signs and symptoms associated with it. If you or a loved one is struggling with barbiturate addiction, know that help is available. Seek professional treatment soon as possible to begin your journey to a healthier, happier life. Barbiturate overdose treatment. Treatment for a barbiturate overdose usually involves supportive therapy, such as respiratory support, fluid and electrolyte management, and medications to help prevent seizures and other complications. Proper treatment of barbiturate overdose may also require hospitalization for observation and monitoring. Barbiturate overdose is a medical emergency that requires immediate treatment. The barbiturate overdose first aid and treatment may include the following. Supportive care. Treatment for barbiturate overdose often includes supporting care to control symptoms and stem additional health problems. This may include oxygen therapy to help with breathing or intravenous fluids to help maintain hydration. Stomach pumping or activated charcoal. If the overdose is caught within a few hours of ingestion, pumping the stomach can effectively remove the drug from the body. Activated charcoal may likewise be given to help sponge the drug in the gut to stem it from being absorbed into the bloodstream. Antidote medication. Flumazenil is an antidote medication used to reverse the effects of barbiturates. It is typically administered intravenously and can quickly and effectively reverse the drug's sedative effects. Monitoring. People who have overdosed on barbiturates may need to be monitored in the hospital or an intensive care unit for several hours or days, depending on the severity of the overdose and the patient's overall health. Individuals who overdose on barbiturates are at risk for severe complications, including respiratory failure, coma, and death. Prompt medical attention is essential in managing and treating a barbiturate overdose. Additionally, it is vital to seek professional help to handle the underlying problems that ushered in the misuse or overdose of barbiturates, including possible addiction or mental health concerns. Barbiturate withdrawal symptoms. Barbiturate withdrawal can be a difficult and dangerous procedure for someone physically dependent on barbiturates or who uses barbiturates in conjunction with alcohol and opiates and often necessitates medical treatment. We take dual diagnosis clients seriously at We Level Up treatment centers because addressing addiction's physical and psychological aspects is crucial to achieving lasting improvements. Contact us today, and let us help you start your journey toward healing and recovery. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.